If you have a vascular problem, our next guest can help. This segment sponsored by Ozark Regional Vein and Artery Center. Dr. Christopher Stout is here. Thanks for joining us.
Hey.
Great to see you, Doc.
Thank you. Thanks for having me today.
Of course.
So today, we're touching on a new procedure, GAE. What can you tell us about that?
Yes, coming to Northwest Arkansas, there's the healthcare delivery in this region is starting to boom. It's starting to get to the point where we're keeping up with the population. And with that, new procedures are coming on into the area. And one thing I've noticed is that a lot of people don't know what GAE is. GAE is geniculate artery embolization. So to make it very simple, if you have knee pain from arthritis, we use a small catheter and we can make that knee pain go away by getting rid of some of the scar tissue and inflammation in the knee. So that's what GAE is. The photo shows some of the procedures that we're doing, and that's kind of what we're trying to do is get rid of the inflammation with the GAE.
Yeah, for sure. How do you determine if someone is a good candidate for GAE?
So GAE is not for everybody. It's not for somebody who needs a knee replacement or is getting a knee replacement. What GAE does is it can help bridge the amount of time between taking medicines, getting steroid injections or other injections in your knee, and then eventually needing the knee replacement. So GAE is for the mild, moderate patients that aren't quite there for a knee replacement but hurt so bad and the medicines aren't really working anymore and they still are being told you need to wait another couple years.
Okay, good to know. Are there any therapies that should be maybe tried before we take that next leap and go GAE?
Yes, definitely. As with anything, non-surgical, non-interventional treatment should always be tried. And one of the best, most perfect things you can do is physical therapy.
Okay.
A lot of people are like, physical therapy, I don't want to go. What am I going to do? I know how to exercise. Now, the physical therapists know the individual muscles and tendons in the knee, and they can target those and strengthen them and help decrease pain significantly. And again, weight loss is very important, and getting inflammatory diet out of your life, getting rid of the sugars and the alcohols and
the
all
foods
that.
that make you inflamed,
Exactly.
right?
Yeah.
That makes total sense. So you want to start with that therapy and try to regulate it that way. And if it becomes bad enough, that's when there's an opportunity for the GAE?
Yes, then there's the opportunity for the GAE. If the patients or the people, they're hurting when they're running, they're hurting when they're biking, they've had a knee injection, they're taking a significant amount of ibuprofen or some other type of non-steroidal anti-inflammatory drug like Mobic, and it used to work really well, but now I got to take a lot more and I got to take it all day, and when those medicines start to not work as well, or you're starting to get frustrated with having to have all these non-invasive treatments and they're not working as well, that's when it's time to do this.
Okay.
So now, talking real results from the GAE, does it really eliminate all the pain, or what are we talking
Yeah,
about?
another very good question. So there are multiple trials out there, and the FDA actually granted a new device, the spheres that we use to embolize these knees. They actually granted them breakthrough technology last year to be used for this.
Wow.
Because the data shows that it has a 99% technical success rate, meaning that we're actually able to deliver the little particles down there to get rid of the inflammatory tissue. And then 80% of all the patients that we treat will at least experience a 50% or greater decrease in pain. So
That's a big number.
basically,
That is a big number.
yeah, it's a huge number. Imagine if you have knee pain almost every single day of the month, imagine if you could get 2 to 3 weeks without knee pain in that month.
Right,
Wow.
just doing normal
Impressive.
stuff. So this really is a procedure that you would recommend to a loved one or friend.
Most definitely. I've actually considered doing it to my own knee. But unfortunately, my knee is a meniscus and it's not arthritis, not yet anyway.
Right.
But my father lives in Nebraska, and he's actually called me and he wants to come down and have it done.
Yeah.
Oh, wow.
So
big.
so it's
Yeah.
big, and it's something that I would consider doing for my father. But being a relative, I'd prefer somebody else did it.
Sure.
It's one
Yeah,
of those
makes
things.
sense.
Yeah.
So if folks want to learn more information or maybe seek out treatment, how can they get a hold of you?
Yes, definitely. Call our office. We have a great website where we've talked about this, a little short podcast thing. And then just get on Google. Google GAE for knee pain. And
Great.
that is a great place to find us or anybody that can do this procedure. I think it's very important for Northwest Arkansas, not just me alone, but everybody to help bring this technology to everybody in Northwest
Certainly.
Arkansas.
Yeah. Thank you, Dr. Stout. Thanks
Yeah,
for
you're
joining us.
welcome so much.
Absolutely. Yeah, love it. Love that you're making us healthy here in NWA.
Yeah, exactly. Keep people on bikes.
That's right.
Yeah, that's
Got to.
it.
Yeah.